Okay, thank you. You let me know when you are ready. My apologies. Thank you. Welcome, Senate Labor, Health, and Social Services Committee to the 68th, our first committee meeting of the 68th Legislature. We'll do a roll call just this time for the, I guess, the exercise. I think, but from now on, if all members are present, I'll just acknowledge the members are present. And if someone's not here, well, excuse them, and all the others will be known as being here. But since it's the first time for our good senator to be a part of his interim committee, we'll call a roll for this one time. Thank you. Please proceed.
Senator Crum.
Here.
Senator Hutchings.
Here.
Senator Scott.
Here.
Senator Steinmetz.
Here.
Chairman Barlow.
Present. Thank you. All accounted for. So congratulations. Your first committee meeting you're in attendance to.
Thank you, Mr. Chairman.
All right. So it is kind of fun. You remember that, probably that day when we came in together, Senator Hutchins?
Young kids.
Yeah, just young kids. Charlie does not remember. It's been, maybe he does.
It was a House Judiciary Committee.
Oh, very
And
nice.
that was very educational experience.
Oh, very nice. Well, good. Well, good. All right. So we just have one bill before us today, and there's obviously a vigorous crowd here in the audience. We know how meetings work, and things run through the chairman. We'll take testimony, then have any discussion within the committee, and then move the bill and work the bill, and hopefully dispense with the bill in an appropriate manner the committee desires. So with that, actually only Senator Hutchins and I are returning members from the Senate Labor Health Committee. And I believe only Representative Clouston is the only returning member on the House side. The only returning Republican on the House side, right? Representative Yin is also. So we'll have in our interim, when we do joint work, will be a lot of new folks to some of us. But anyway, so the good representative has agreed to come and present this bill. It was a bill that he actually brought to the attention for the interim, the 67th legislature. So Representative Clouston, thank you for being here. If you will please walk us through Senate File 23. You can skip the first 3 chapters of your intro and just get right to the bill. Anyway, thank you for being here. Appreciate it. Welcome.
Thank you, Mr. Chairman. Thank you, committee members. So I'll give you just a brief recap of the bill.
Is that microphone on?
Yes, I can get it closer though.
Yep,
Better?
perfect. Yes, thank you.
So this is a topic I brought to the committee for an interim topic based on a situation we had happen in Gillette, where a podiatrist had performed a surgery. The patient needed a temporary handicap placard. In my building, we had a physician assistant, we had physical therapists, but we did not have an MD or a nurse practitioner. So we had no one to write for this placard. So currently in Wyoming, only advanced nurse practitioners, doctors of osteopathy, and medical doctors can write for these handicap placards. So on your desk, I gave all of you a copy of what the qualifications, eligibility requirements is put out. So they're pretty straightforward. So as we worked this bill in the interim, it received unanimous support throughout our interim committee. And we added certain professions to help write for these. You can imagine if in Gillette we have problems finding physicians available to write for these placards, what happens in a small town in Wyoming. There's really nobody available to help with this. So clients are making extra appointments trying to get this resolved, and it's an inconvenience to our patients in Wyoming. So with your permission, I'll just go through the bill, show you what we did a little bit different.
Please proceed.
So on page 2, what we did is we added a few professions that can help write for these both permanent and temporary handicap placards. So to the previously mentioned list, we added physician assistant, physical therapist, occupational therapist, podiatrist, and optometrist. And the optometry was added because of the visual requirements that are outlined in the transportation's eligibility. And that really is the meat of the bill. So on page 3, we once again add the certain professions. And that is the simple 4-page bill that we worked on, and appreciate everybody's support on this and trying to get more access to care for our patients and also decrease some costs for our patients in Wyoming. So I'll stand for any questions.
All right, thank you, Representative. Senator Scott.
Mr. Chairman, my question is, this is a national, I suppose maybe even an international system. Are there any national standards as to who can write for these things and who can't? Are we at any risk of running afoul of any national requirements?
No,
Thank you.
there's,
Representative
oh,
Klausner.
sorry, Mr. Chairman. Thank you.
Thank you.
Senator
Go ahead.
Scott. There's no national requirements, it's up to states. So I looked like, for physical therapy, there's 37 states where physical therapists can write for these. So it's by a state basis.
Okay. Any further questions for Representative Klausner? And I think Representative Klausner also mentioned that really this affects both temporary and permanent. So that's why it's in two places for a good reason. And then there's also some stricken language on the page 4 that strikes out physician's letter and just refers back to that subsection C. So there's really 3 references to that list of providers contained now within the legislation. Further questions for the representative? And actually, I should also, to the members of the body, now Representative Clausen is the only licensed practitioner in the entirety of the committees as well. We had a nurse practitioner on the House side last year and Representative Clauston, and she's no longer on that committee, so she's our only healthcare licensee anymore.
Mr. Chairman, so I did find out this morning, Representative McCann from Rock Springs is a physician assistant, works in an orthopedic clinic, so happy to see that there's two
Two of
medical-
you,
Yeah,
all right.
2 of us now, so.
We just doubled it. We just doubled
you.
it, just like that. All right, perfect. Well, thank you very much. Anyone in the audience want to give testimony? If you do, please come forward. We also have 2 people that have signed up online. Are they available? Okay, so we have some online testimony, and then we'll we'll have our in-person testimony, and then we'll take whoever's online. Please proceed, introduce yourself, and address the committee with your interest in this bill.
Thank you, Chairman Barlow. Taylor Rossetti, Deputy Director for YDOT. We are the agency that issues the placards. I believe that Representative Clausen did find an absolute need out in the community. I think this bill addresses it well. I did want to applaud the committee for actually being very thoughtful about the people that they added to that list. I think they're all set. They all make a lot of sense. They're all people that would have direct knowledge of a person's ability to walk or to ambulate, whether it be a permanent issue or a temporary issue. The department just wanted to let the committee know we appreciated the work on the bill and would stand for any questions.
Thank you, Mr. Rossetti. Good to see you. Congratulations on your deputy directorship now. Is that what yeah, congratulations. Any questions for Mr. Rossetti? Yes. Senator Hutchins.
Mr. Chair, thank you. Mr. Rossetti, I didn't recognize you, and it's just a pleasure to see you again. That's all I wanted to say.
Mr. Chairman, Senator Hutchings, it's nice to see you again as well.
Anything else for the Department of Transportation? All right, thank you for being here. All right, please.
Mr. Chairman, I think I'm in the low chair here. I feel
Yes,
a little
you
bit like
did.
a little kid at the table. Carrie Klein, I'm with the Wyoming Optometric Association, and just want to take the opportunity to say that optometry always wants to look after its patients and in a rural setting. So they're happy to be included in the bill and help as they can.
Very good. Thank you. Any questions for Ms. Klein and the Optometry Association? Seeing none? All right. Thank you very much to both of you. So who do we have online?
Mr. Chairman, there's Erin Friday. I've requested that she raise her hand if she would like to testify. She is-
Ms.
they have not
Friday,
yet.
if you would like to testify, please indicate so to our staff so they can allow you into the Zoom, please. And if you're in support and just want to give a thumbs up, that's fine. He'll report that to us. And don't want to speak, All right, further comment in the room? Anyone online want to raise their hand to give comment? You signed up, so I want to make sure we give you, I could do the auctioneer thing, going once. Nothing yet? Twice? All right. I think public testimony is closed. Committee, you have a bill before you. What's your pleasure? We have a motion by Senator Hutchins. And I don't think we'll actually worry about seconds in this size of committee. Does anybody have a concern with that?
You know, I've always had a concern with that.
Would you like to do a second?
So I don't know how everybody else feels.
Well, we'll do a second. If one person has a concern, we'll just do seconds. No.
Second.
There's a
Mr.
second.
Chairman, second.
There's a motion by Senator Hutchins, a second by Senator Crum. Discussion on the bill. We can walk through the bill quickly. Discussion. Any amendments to the bill? Seeing none. Would you call the roll on the bill?
This is a roll call vote for Senate File 23. Senator Crum,
Aye.
Senator Hutchings. Aye. Senator Scott,
Aye.
Senator Steinmetz. Aye. Chairman Barlow.
Aye.
That is 5 ayes.
Thank you, committee. This bill has passed the committee. I think unless somebody volunteers to take it, I'll be glad to take it whenever we start committee of the whole. If somebody'd like to take it, they're welcome to. Mr. Crum, you're a freshman. You want to just go out of the, you want to go out the gate?
Mr. Chairman, I'd be happy to do it.
All right. Yeah, well, we'll be there to support you.
Forgive me.
So, we'll be there. He's got 5 pages of notes if you need them. All right, committee. Yep, take all that supporting material, your bill draft. So that ends our business for the day. Just a heads up, we have the 2 bills that have been referred to us. One is the music therapist bill, and we will hear that on Friday. And we will, I think, only have remote testimony because apparently the roads in some parts of the states are getting pretty bad, part of the state are getting pretty bad. So there'll be some remote testimony, I think, out of Teton County that I'm aware of. And then because of the absence of at least one of our members and a couple other members from the body on Monday, our consideration of the third committee bill, which is reporting immunity for drug overdose reporting, will be Wednesday or Friday, just depending, and I'll kind of watch to make sure we have, and I only see 2 other bills. I know there's maybe other bills haven't been introduced or haven't been filed yet, but I only see maybe 1 and maybe 2 other bills that might come to this committee out of the Senate so far. Like I said, I'm not, notwithstanding some other things that aren't out there yet. So we may not have a very heavy load unless the president asks us to take on something else. So with that, for any further business from any of my colleagues? All right, thank you. We are adjourned. Anything else you need from me, Clayton? No. All right, thank you. Thank you. Did you get these?
Yes, sir.
Okay.
You might want to just give them to the body when you present your bill.
Okay.